Hello, my name is Dr. Dewan S. Raja. Today I will discuss about the deep cervical fascia. The deep cervical fascia has 4 layers and that encloses the structures of the neck. We have the investing layer, most superficial among all the deep cervical fascia. The investing layer covering the muscles and the salivary gland. Salivary gland means the parotid gland and the submandibular gland here. Pretracheal layer for the muscles, the pretracheal muscles, and pretracheal layer for the viscera like that of the trachea, esophagus, and also the thyroid gland. Prevertebral layer covering the muscles around the vertebra. So investing layer is the top of all. Then pretracheal layer, it has 2 subdivision, one for the muscle, especially for the infrahyoid muscles. Pretracheal for the viscera. Viscera means here the trachea, esophagus, the thyroid gland. Prevertebral layer covers the muscles around the vertebra. And all the layer contribute in the carotid sheath that extend from the base of the skull to the root of the neck and that contain the common carotid artery, internal carotid artery, vagus nerve. We have another video about the carotid sheath. If you have time, please look at that. Okay, let's go to the deep cervical fascia today. We have the deep cervical fascia has the investing layer of the deep cervical fascia. This is the investing layer. And if we go to the previous image, we'll get again the investing layer of the deep cervical fascia. Then we have the muscular portion of the pretracheal fascia, visceral portion of the pretracheal fascia, and deep to that we'll get the prevertebral fascia. And carotid sheath is contributed by all these fascia for the blood vessel and the vagus nerve. So it surrounds the neck, splits to enclose 2 muscles here, the sternocleidomastoid muscle anteriorly, posteriorly the trapezius muscle. Okay, here it is there. Trapezius, this is the sternocleidomastoid muscle anteriorly, posteriorly the trapezius muscle. And this layer of the deep cervical fascia is beneath the platysma. Platysma is subcutaneous muscle. This is muscle of facial expression. The investing layer of this cervical fascia is deep to the platysma. This is the platysma. Attachment of the deep cervical fascia superiorly along the mandible. Mandible means the base of the mandible here to the mastoid process, external occipital protuberance, and superior nuchal line. So here then we'll go to the mastoid process of the temporal bone and we'll go posteriorly to the superior nuchal line. Okay, anteriorly here is the base of the mandible. Okay, inferiorly to the acromion process of the scapula, to the spinous process of the scapula, to the clavicle, and to the manubrium sterni here. Okay, here is the clavicle. Then if we go laterally, we'll get to the acromion process. If we go posteriorly, we'll go to the spine of the scapula. This is the attachment of the deep cervical fascia. We have some structural relationship. We have the transverse cervical nerve, external jugular vein over the investing layer of deep cervical fascia. We have the facial nerve, the cervical branch is going there, and this innervates the platysma muscle. Okay, so investing layer is above all the layers of the deep cervical fascia. The pretracheal layer of the deep cervical fascia, pretracheal layer is limited to the anterior aspect here. and it contribute in the carotid sheath is here. This is the pretracheal fascia. It covers the viscera like that of the thyroid gland, the trachea here, the esophagus here. It also covers the infrahyoid muscle like this here and there. So infrahyoid muscle are covered by the pretracheal layer of the cervical fascia, but the sternocleidomastoid muscle and the trapezius muscle is invested by the investing layer of the deep cervical fascia. And this is the prevertebral fascia around the muscles around the vertebra. And the investing layer of the cervical fascia is around the entire, like a collar around the neck, and pretracheal fascia is confined anteriorly, and prevertebral fascia is around the vertebra. We got that. Continuous with the buccopharyngeal fascia and carotid sheath, attached to the hyoid bone, thyroid cartilage, cricoid cartilage, and the fibrous pericardium. Attachment of the pretracheal fascia to the fibrous pericardium. Okay, so this is continuity with that of the buccopharyngeal fascia for the buccal muscle and the pharynx. Okay, prevertebral layer of deep cervical fascia encloses vertebral column and associated muscles, covers anterior, middle, and posterior scalene muscles, and the deep muscles of the back. Attachment to the external occipital protuberance, basilar part of the occipital bone, and the anterior longitudinal ligament of the thoracic vertebra. So we have the prevertebral layer of the deep cervical fascia. It again has two layers, anterior layer and posterior layer. In between, a space is present inside inside the prevertebral fascia. That is called, some books say it is a danger area. Okay, the danger space between the anterior and posterior layer of the prevertebral fascia in front of the vertebral column. Attachment, external occipital protuberance, basilar part of the occipital bone, and the anterior longitudinal ligament of the thoracic vertebra. We have some other part of the deep cervical fascia. We need to consider those, like alar fascia subdivides the retropharyngeal space at the midline of the buccopharyngeal fascia, extend from the base of the skull to the C7 cervical vertebra. Buccopharyngeal fascia covers the buccal muscle and the pharynx. And the buccal muscle is a muscle of the facial expression. Okay, and it also covers the pharynx, blends with the pretracheal fascia, attaches to the pharyngeal tubercle. Pharyngeal tubercle is present at the base of the skull, on the occipital bone, in the midline, and to the pterygomandibular raphe. Pharyngobasilar fascia, another component of deep cervical fascia, a fibrous cord inside the pharynx, between the mucous membrane and the pharyngeal constrictors. We have three constrictors: superior, middle, and inferior pharyngeal constrictors. Then this is the very important space clinically, retropharyngeal space. Clinically, it is the space between the prevertebral fascia and the buccopharyngeal fascia, extending from the base of the skull to the posterior mediastinum. Anatomically, this is between the buccopharyngeal fascia and the anterior lamina of the prevertebral fascia. It is clinically between the prevertebral fascia and the buccopharyngeal fascia, because on MRI, CT scan, we get the only one layer of the prevertebral fascia. Okay, so clinical anatomy is very important to us. We must give emphasis on that. Retropharyngeal abscess, retropharyngeal space we discussed clinically, the space between buccopharyngeal fascia and the prevertebral fascia, may spread from the neck to the posterior mediastinum. Anterior neck infection, infection in front of the pretracheal fascia, may go to the superior mediastinum. Parotid swelling is very common, especially any infection in the parotid gland. Maybe some type of viral infection like mumps, then parotid gland is swelled up and it is covered by the parotid fascia. That is a component of the deep layer of the investing layer of the deep cervical fascia. So it made the very much tense situation. So parotid swelling may be painful due to tense parotid fascia, a part of the investing layer of the deep cervical fascia. So here this image is from the Gray's Anatomy 41st edition. We are getting the pretracheal fascia. We are getting the investing layer of deep cervical fascia covering the muscle here, sternocleidomastoid muscle and the trapezius muscle. We are finding the prevertebral fascia over the muscle around the vertebra, and this is the buccopharyngeal fascia, a component of the posterior aspect of the pretracheal fascia. Okay, that buccopharyngeal fascia and the prevertebral fascia, this space is the retropharyngeal space. It may go through infection, maybe a fishbone, maybe even the tuberculosis of the vertebra, that is also possible. There may be collection of pus between the anterior and posterior layer of the prevertebral fascia, or between the buccopharyngeal fascia and the anterior layer of the prevertebral fascia. And that abscess may spread to the posterior mediastinum. Okay, this is the carotid sheath contributed by all three layers of the deep cervical fascia. Okay, we got these are the muscles. These muscles are the infrahyoid muscle, and also our deep cervical fascia contribute in the formation of the stylomandibular ligament, like the investing layer of deep cervical fascia. The pretracheal fascia contribute in the formation of the attachment of the intermediate tendon of the omohyoid, and the tendon between the anterior belly and posterior belly of the digastric are attached to the place by the pretracheal fascial condensation. Okay, and that's all about the anatomy of the deep cervical fascia. If you have any question, please feel free to ask me. Please share the information with your friends. And please support my channel. Please subscribe me. Have a nice day. Bye now.